Hey there, it's Huang here with Hand Therapy Secrets. Wanted to come on live today because I've been doing a couple of calls. I've been talking to my students, and it's exciting when people are like been working on hitting their goals and they're actually doing the thing that they have set out to do. So I don't know if you guys know, but everyone's starting to take their exams right now. So if you are taking your exam and you see this, like, how are you doing? How are you feeling? Let me see. I can't see the way I set up my computer today. Okay, there you go. Can't see who's joining. So anyway, I know this is last minute and I just came on. I didn't even tell you guys I was coming. So, if you're watching this right now, say hello. If you're watching this on replay, please leave me a comment. So anyway, I just wanted to come on and really just dive into a little bit like how to best study for the hand therapy exam. And the reason why I'm doing that is because this whole cohort of mine is currently taking the exam in the next 2 weeks. And I'm also bringing in a whole new cohort of new members that are joining the hand therapy. The exam prep essentially to study for the exam in May. Because November, right around this time, is when people are thinking, like, should I be studying for the May exam of 2023? So if that's you, you might be thinking about it, and you're thinking, what are the resources do I need? What are the best ways to study? So I want to come on and kind of share a little bit about what we're doing currently in the program. And you are welcomed if you are kind of struggling. You're like, I don't know what I should be doing, or I've tried studying on my own. I keep putting it off. And the exam prep program is currently open right now, so you can apply. If you're on Instagram, you can click the link in the bio. If you're watching this on YouTube or YouTube or Facebook, then go ahead and go to handtherapysecrets.com, but later, and kind of just look through what the program is about and how this program can help you and all that good stuff, right? But stay tuned because I want to share with you like the best ways to study for the CHT and what my students have currently done in order to prepare to take the exam this time around this November. So testing started end of last week, and it's going through until the mid of November. So if you see people out there, pray for them, wish them luck. The exam is, it's a pretty difficult exam. The pass rate is about like 55%. It changes between 50 and 60% depending on the year. But for the most part, it's consistently hard. It is consistently challenging. And one of the reasons why the exam is consistently challenging is because you are studying to be an expert. Like, they want you, if you're going to get those letters, they want you to know what to do, they want you to know what to say, and they are relying on you to show up, to talk to patients in a particular way that can really help them understand what's going on, to talk to your referral sources. And when I talk about referral sources, I'm talking about your doctors, or maybe if you work in workers' comp, the adjusters, the case managers, the nurses, and really be able to explain like what's going on, what can happen, what are some of the recommendations that you have. I think one of the things that we need to recognize as certified hand therapists, as occupational therapists, becoming certified hand therapists, is that, in order to, become that expert, and in order to feel confident in what we're doing and what we're saying, we need to understand that people are actually looking to us to provide those answers. Do you know that? Doctors cannot wait for you to be like, yes, I know about this. This is what I recommend based on this type of injury. I think that, therapy, conservative therapy works, is like this, and I want to see results in X amount of time before I make any further recommendations, right? And some doctors are like, they just write that they need a splint, and then they rely on you as the expert, as the certified hand therapist, to know, well, which splint is the best splint. Because sometimes they just write whatever they're writing, and then they're waiting for you to be like, oh yeah, this splint is better. Do whatever you need to do, Huang. That's what they tell me when I say, hey, based on this type of injury, this person needs this kind of splint. And, it's for X, Y, and Z. Okay, go ahead, do whatever you need to do. All right. That's like key. So when you study in a way that helps you to to know what to say, know what to do, that's going to really set you apart, not only in practice, right? Not only in practice, but it's going to help you pass the test. It's going to help you pass the test, right? Someone had a question. I was on a call earlier today, and someone said, is the certified hand therapy exam like the OT boards? It is not like the OT boards. It is not like the OT boards. I think in the OT boards, there was a lot more in terms of memorization. Like you have to memorize a certain amount. In the hand therapy exam, it is very much applied information. So just memorizing stuff is not that helpful. You have to know how to apply the information that you know. And one of the things is they provide a lot more details in the things that you need to know, right? So as an occupational therapist, you're studying like in a broad sense. You have to study all the not the nerves. You have to, there was very little nerves. You have to study from a neuro standpoint. Like, how does my brain work, right? From a neural standpoint, how does my brain work? What happens if I have a stroke? From a cognitive, perceptual, how does the brain send messages down to the arm to move? Well, on the exam, you kind of like for the hand therapy exam, you already know that shit. So what do you now need to do for the arm? Believe it or not, strokes on the exam because it's an arm problem. Every time I talk about nerve issue or neuro issue becomes orthopedic issues. A neuro shoulder becomes an orthopedic shoulder because it hurts and because it is not in alignment anymore and because the muscles don't move, and the glenohumeral joint is no longer stable. If the muscles are not holding it and you have like a lot of subluxation, and then the active muscles aren't moving well, and so the scapula to the chest wall doesn't have enough mobility because the muscles are, have a lot of tone in certain places and, flaccid in other places, so there's a certain understanding that needs to occur when it comes to like neuro cases. CP issues come, affect the arm as well in a lot of different ways, right? But that's like one small little aspect of the exam. Majority of the aspects of the exam is on surgical cases, right? But in order to understand surgical cases, you've got to understand the anatomy. You have to understand the anatomy of the arm, right? But one of the best ways to break it up, the best way to study for the hand exam is to really chunk the information down into pieces, right? Rehab of the hand is not a novel. You do not need to read it from cover to cover. You need to be, judicious about what you're reading, how you're studying, because not all information is good information. You don't need all of it, right? So the best way to study is to chunk that information down. So how can you chunk it down in a way that makes it easier? So one of the things that I do in my program, and I have a very particular curriculum in my program, which is to talk about, first we talk about hands, then we talk about wrists, then we talk about tendons. And even though tendons are a part of hand injuries, right? They're a big, huge part of hand injuries. You can still you can still separate it because there's so many issues that when it comes to hands, like flexor tendons, extensor tendons, it comes its own thing, right? But then when you study it in that particular order, then you can tie everything together, right? You can tie it together, and then then I tie burns and wounds, because once you understand hand anatomy and wrist anatomy and tendon anatomy, and then you start talking about the more complex stuff, you can tie it all together. So if you want the best way to study for the exam, one of the things that I do is chunk up the information, right? In the exam prep program, it's done for you. Like, so there's I break down all the different chapters, I chunk up all the information, and then we create what I call showcases, right? Or modules, essentially, that go over all the hand stuff. You can come in, you can binge watch all of the videos. And one of the great things about the videos, the video library, it's really all coming from Rehab the Hand. It's all coming from chapters where I've taken the most useful, the best information, and then put it in a way that's digestible, that's easy, that makes it easy to understand and easy to remember, so that when you actually, so sometimes people only watch the videos, and then some people are like, no, hold on, I need to read because I don't want to feel like I missed out on anything. But when they watch the videos first, then they go to read, because they already understand so many concepts and keywords in there that they're looking for. Reading is much faster, right? Reading is not just much faster, but there's a lot more comprehension to it. Right. So essentially, if you're studying for it, that's one of the best ways that I recommend studying it. So it's easier, it's faster. And if you're interested, you could apply for the program today. The link is there in the bio. But if you're doing it on your own, you can chunk it up yourself too. Like, I'm sharing this for you so that you don't have to waste time. Right? It does not need to be as hard as everyone says it is. Does it take work? Absolutely, 100%. There is nothing in this world that you could do that is fulfilling, that is meaningful, that doesn't take a certain amount of effort, right? You didn't just like wake up and apply for the school to be an occupational therapist and boom, came out and you're an occupational therapist. It took a certain amount of work for you to become an occupational therapist. It takes a certain amount of effort for you to become an occupational therapist. So now this is the next level. This is the next step for you. I often talk about when you are a certified hand therapist, it not only helps you to become more marketable, right? So that you can have more choices in your career. People with their certifications, like, let's talk about any certification, right? Let's talk about any certification you could potentially be working towards. It makes you more marketable. It says to someone who doesn't know you that you know your shit, right? If you're a certified hand therapist, you could come out there and be like, I know what I'm doing, what I'm talking about. So when you study for the exam, you will learn why you're doing what you're doing. You'll learn what you're doing. You'll learn what to say, how to say it, and how to get some of the best results. I actually was talking to a member of the program. She's going to be taking her exam pretty soon. And she said that to me. And it was funny because I had the same realization when I was studying. But she said to me, man, as I started to understand more, because she was studying on her own before, wasn't successful, but in this particular format, she started to understand not just wrist kinematics, right, which is like how the wrist bones move and how it relates to the metacarpal and the and the ulna and all that stuff, and how it relates to how important all the ligaments are. But when you understand how it's supposed to actually move when normal, and then you understand the nature of the injury, and you put the two together, and you're like, oh shit, that's what I'm supposed to do in terms of treatment, and this whole time I've been doing it wrong, right? So it just like expands how you think, how you treat, and it helps you feel so much more confident about what you're doing when you are talking to your patients and you're like, this is why I do not ever prescribe for people to squeeze a ball in their hand. There's a time and place for strengthening. There is a time and place for strengthening. But let me tell you, if you have stiff fingers, right? If you don't have full or mostly full motion, like passive active, why would you put something in there to work on strengthening, right? Your problem may not be because you're not strong. Your problem could be because you don't have enough joint motion to be strong. What if you had a lot of pain and they're like, just squeeze the ball so you can get stronger? Well, is it because you're not strong? Or is it because you have so much freaking pain that you cannot have strength, right? So which one is the problem? So when you study and you understand these concepts, it really does change your practice. It really does help you to become a better therapist. It really helps you to feel really confident to know what to do, what to say, so you can get results for your patients. It really helps you to understand why a surgeon picks a certain type of procedure. You can understand why you would recommend a procedure to a particular surgeon about your patient. You can make recommendations on when to get started and why that is important. I have a guy who, and this is not on the exam, but I have a guy who has had multiple surgeries and he just had another surgery. And he didn't come to us initially from the initial injury. But we have an opportunity right now that he had a new surgery to make the biggest difference, right? Because we know his personality, we know how he kind of works or doesn't work, right? We know we can make the best recommendation. So when I often talk about second surgeries, when people are going for releases and stuff like that, we're allowed to start right away. We don't have to start like day one, but we can start right away. And one of my biggest things is I recommend daily therapy. It's aggressive, right? Doctors like aggressive range of motion, aggressive therapy. Okay, you want aggressive? Please, based on X, Y, and Z, based on his past history, his complex case, and the fact that he does not move on his own, especially when he has pain, please, I'm recommending this is an aggressive recommendation, but I'm recommending daily therapy for the first month. For the first 4 weeks, please let him come in on a daily basis so that we can get his movement going better, smoother, where we're not like cranking on him, because if he has more pain, he's not going to want to do this shit on his own. So if we can just go slow and steady and move in a way that's going to be helpful to him, so he has less pain, we can reduce his edema, we can ensure that the wound is healing, and we just like actively move him more. Could that increase our chances of getting better results? Well, that's better than him just coming 2 to 3 times a week, right? But when you study in a way that helps you to feel confident, right? When you study in a way that helps you to feel confident, you're just gonna show up differently. You're gonna show up differently. You're gonna show up differently for your patients. You're gonna show up differently for the exam. You're gonna show differently for yourself. So give yourself the best possible chance of passing the first time, right? Give yourself the best possible chance. So, like I said, some of the best ways to study is chunking the information down. The second thing is just making sure you're studying from the right resources, right? Studying from the right resources. So, if you don't have Rehab of the Hand, please buy Rehab of the Hand 7th edition, right? So I really recommend, if you don't currently have one and you're gonna buy one, buy the 7th edition. It's well worth its spend. You can keep it as a resource for yourself moving forward. If your company supports you, they may be able to purchase it for everyone else who's going to come after you that may want to develop and grow their skills. But it's a great resource to go back to. And then pick one or the other in terms of resource review books. So there's the Ashta review, and then there's the Purple Book. The Purple Book is more like practice questions, but there's a lot of review stuff there as well. And then the Ashta is like everything really at the end of the day, everything's coming out of the rehab of the hand. Y'all people know that, right? The Ashta is just another rendition of Rehab the Hand done in less written words. So some people do well with just the outline, but then what happens that I've heard is that you end up having to look a lot of stuff up. So when you look a lot of stuff up online, what can happen is you start falling down the rabbit hole of spending all your time looking shit up, and then you have to have a lot more judgment of what actually is beneficial for you for the exam and what isn't. Let me see your question. Rehab of the Hand, upper 7th edition. Yes, that's I got my computer on it, but otherwise I'd show you 7th edition. But I definitely recommend it. It is not the easiest book to read. I am by no means saying it's easy, but it is definitely the resource that you want to go to when you're studying. I usually say if you start researching a lot of stuff everywhere, and trying to like piece your information together because they're free resources, what happens in free is that you're using a lot of your time, right? You're using a lot of your time because you have to like now weed through that shit and say, okay, what is really important? Rehab of the Hand is there for you, just like all the resources. But like I said, it's really dry. And that's why the exam prep program has all of the videos like chunked out, like all of the chapters chunked out, all the videos like going over some of the major concepts and breaking it down so that when you do read, it's that much easier and it's just like faster, right? So if you are more than just a reader, majority of the people in my program are like, Huang, I cannot get through the book. I cannot understand it when I'm reading it. And when they're in my program, they can watch the videos, they take notes, and when they go back to review certain things in the book, it's that much easier. So, completely up to you, but you are well worth the investment, right? So if you want to study for it the right way, just make sure that you have the resources to make it easier for you. I love YouTube videos. I put tons of YouTube videos out for everyone, but you have to understand that when you're going through YouTube videos, is sometimes they're not telling you the most important things that you need to know on the exam, right? Sometimes there's just like a lot of extra information. So you have to ask yourself, how well worth is all that extra information? Your brain is like an iceberg. You can only fit so many penguins on there, right? Before imagine your brain is like an iceberg and it's full of penguins with all the information you need to know. Every time you're learning more stuff, more penguins are jumping on, but other penguins are jumping off, right? So when you're studying, having too much information and having to weed through the shit is going to slow you down. So having resources that help you study for in an easier, faster way, it just helps you to be more successful, feel more successful, and feel like I can register for the exam May of 2023 because I don't want to keep putting it off. That's the biggest thing. Most people keep putting off the exam because they just trying to do stuff on their own, and then it just doesn't, just another year and another year and another year and another book, and then those books become dated because you still haven't sat for the exam. I'm be perfectly honest. I'm throwing that out. I'm gonna be perfectly honest. That's what happens, right? So best way is to chunk up the information. 2 is to use the right resources. one of the best ways to study for the exam is the exam prep program. So if you're interested, go look at the details of the program. We're starting now. We're actually going to be doing a live call on Thursday. So you can get in, start watching the videos, get the frameworks that you need so that you can study in the most efficient way, because nobody's got time to lose, right? Nobody's got time to lose. There's a lot of information on the HTCC website. And one of the things that I often talk about with them is the way they break it down and how they test you, because it's not just about memorization. It's about understanding concepts in a way that you can know how to apply. You apply it to evaluations, you apply it to prognosis, and you apply it to treatment, right? It's the same thing as when a patient comes into you in the clinic. They're going to come into you in the clinic, and you're going to have to look at them. You're going to have to be like, oh, what is this? What you got there? You got a tendon release. Oh, what am I allowed to do? Oh, you have a tennis elbow. You have elbow pain. Where's the problem? What happened? Right? So from there, you start to understand, like, okay, I've got to pull forward like my anatomy. I got to pull forward like what happened with this injury. And then that's all your general information. Now I need to know how to evaluate them. Where's their problem? Where are they stiff? Where are they weak? Where are they too strong? Is this a nerve issue? Is it a tendon issue? Is it a muscle issue? Is it a muscle alignment issue? Is it a bone? Is it a fracture? Like, what's going on? Right? Oh, I had a lady call me. She actually saw my video on Facebook. No, she saw my video on YouTube, and she was looking for a therapist, but this channel teaches other therapists. But anyway, we're talking to her about like her hand problems. Having to know, you got to know the particular problem. She had arthritis. Well, what kind of arthritis? What happens with the arthritis? What are some of the conditions that are caused by arthritis? Oh, okay. So now what are the symptoms? You have to evaluate, right? If she were to come in, we'd have to evaluate what kind of splint. She was like, well, can you tell me what kind of splint I need? I was like, no, I got to evaluate you first. Right? I got to evaluate. I got to see what's wrong. I got to see what would actually help you, versus just guessing, right? I have to understand the root cause of that problem. I've got to then now apply to, well, what's the timeline? What's the prognosis? Can I actually help her? What would the treatments look like? If that fails, what's next? Is there surgery? Is she going for surgery? Would surgery help with that finger? What about the other fingers? So there's so many levels of application, and that is what the exam tests you on, right? So one of the best ways to study is to ensure that you're applying the information that you're knowing, that you're taking so much time to memorize, right? So instead of just memorizing it, understand it fundamentally, what to do, what to say, how to do it so that you can get the results, right? Number 3, the best way to study for the exam is to apply for the exam prep program. So I can help you stop putting it off. I can help you chunk up the information in a way that's going to help you not just study in a way that will help you pass the exam, but help you to understand what you're doing in the clinic. Even if you do already know, you actually learn so much when you're studying, and you get so much clarity and certainty about it. And then it will help you cut the dryness of the book. It will help you to solidify the information. So when you go and sit for the exam, you know exactly how to pick the best answers, right? So those are the 3 best ways to study for the exam without having to waste a ton of time, because your time is now. Stop waiting for your turn. Nobody's going to come and be like, it's your turn to become a certified hand therapist. You got to take your turn. You got to go there and say, I know it's possible for me to, put the effort in, make the commitment, right? And then study in a way that gives me the confidence so that I can show up for the exam, right? The best thing about this test is that you don't have to do it. But the worst thing about this test is like you don't have to do it, right? It's because you want to do it. So if you want to become an expert, if you want to have more choices in your career, if you want to be able to, go and work in the settings that you want, if you want to be able to pick and choose your positions, if you want to go out and start your own clinic, much like that as I have, become a certified hand therapist now, not later. All right. I'm gonna say my piece. All right, I gotta go. The sun is starting gonna shine in my eyes in a minute. So I'm gonna run. But if you have any questions at all, if you're interested in the program, if you're on Instagram, send me a message, And if you're on Facebook or YouTube, you can send me a message or go to our website, handtherapysecrets.com, and click on the link about applying for the hand therapy exam prep program. And I will talk to you guys soon. All right. Thanks so much. Bye.